Can I come in? Good morning. My name's Miranda. I'll be your nurse today. Do you care to tell me your name and date of birth? Let's take a look at your armband over here. All right, Mr. Smith, thank you. It looks like that we need to do a TB skin test on you today. Have you ever had one of those before? You have? Okay. All right, so I was just going to ask you if you minded if I let my students come in and watch. I have some students here today, and we're going to do this intradermal injection, and I would really appreciate it if you'd let me explain that to them while I do it. Okay, thank you very much. All right, so guys, the first thing that we're going to do is we've ID'd Mr. Smith. We have checked our MAR. We've made sure that we know the medication, the dose, and the route. And we've assessed drug allergies. So, Mr. Smith, are you allergic to anything? Not that you know of. Great. All right, so I'm going to go ahead and do hand hygiene. And I've already pulled my medication from the Pyxis. So it is the PPD, which is just a little bit of medication that we're going to inject underneath your skin. We call it intradermal. So it's just really in that dermal layer of your skin, not real deep. And then we're going to watch that and see if you have a reaction to it over the next several days. Okay? All right. Any other questions? All right. So with the students, I'm going to go through their drug rights. So the students are required to check the medication whenever they pull it out of the Pyxis, outside of your room, and then again before they administer it to you. Okay? They're going to check your armband. They're going to make sure that they check the dose, the route, or how we're giving it to you. They're going to double check the medication, right? And then they're going to make sure they're giving it to you at the right time. Okay? So, right patient, right dose, right route, right time, and right documentation. So they're going to document all this. Okay? Do you have any questions? No? Okay. Well, with that being said, I'm going to go ahead, grab the medication, draw it up, put on my gloves. Okay. So just reminding the students that we did our 3 checks of the medicine that we're giving you, and we did our drug rights. Okay. And so now we're going to go ahead and draw up our medication. So I have my purified protein derivative, or my PPD, that I'm going to administer. I have my needle that I'm going to draw the medication up with. So I just have a very small gauge needle. So I have a 25 gauge, and it's a 5/8 inch needle. So a very small needle. I don't need anything large to go just underneath the surface of that skin. So I'm going to go ahead and draw up, and I'm just drawing up. The dose is for 0.1. And so I'm just drawing up my air, popping my cap, go ahead and swab. Okay. And then I'm going to inject that air into my vial. And then I'm going to go ahead and draw that up without touching the needle. So I'm drawing up my 0.1. Making sure I don't have any air in there. Okay. And then make sure I got my 0.1. Okay. And then just remember, we're not going to recap because we don't want to stick ourselves. So I'm just going to do the scoop since I haven't stuck the patient yet. Once the needle has been stuck with the patient, you should never recap, not even in a swooping motion. Okay. So I'm just doing that so that I can set my needle down and go ahead and verify the site that I'm going to perform this intradermal injection on. So I've got the patient in a nice comfortable position. For injection sites, usually the sites that are best are the ventral surface of the forearm and the upper back. We can use the upper chest in Mr. Smith here, we're going to put it right here in his forearm. So I've got him kind of semi-flat to where he's comfortable with his arm extended to where I can get to it very easily. I have the bed up so where it's a comfortable height for me to work. I have my gloves on. I'm going to go ahead and clean the site. So I'm just going to use an alcohol swab, and I'm just going to do circles working outward. Okay, and then I'm just going to go ahead and let that dry. Keep in mind that depending on the product that you're using, whether it's alcohol or the ChloroPrep, ChloroPrep you generally go back and forth with alcohol you want to do in a circular motion. Just pay attention to whatever your facility's protocol is. So we want to let that dry before we inject. Remember, the drying of that is how the germs are killed. So now we're going to go ahead and we're going to take our non-dominant hand and we're going to hold the patient's skin taut by using one of the following methods. So you can either do using the forearm. We should be able to place our hand underneath here, underneath his arm, right? So underneath his arm, and then pull the skin down towards me, towards the wrist with my thumb. You can also do it by stretching the skin between the thumb and your index finger. Keep in mind that this method, you are more likely to have trouble with your injection because your thumb may be in the way. So if at all possible, we're going to use the method where we place our hand underneath and we pull the skin taut. Okay? All right, so whenever we do this injection, we want to make sure that we've got the skin taut with our non-dominant hand, right? Most people are right-handed, so I'm going to use my left hand to pull taut. And then while I'm holding taut, I want to make sure that I have my needle in my dominant hand. I'm going to make sure my bevel is up, and I want to make sure that the syringe is parallel to the patient's skin at about a 5 to 15 degree angle. And then I'm going to insert the needle slowly, and I'm going to advance it approximately 1/4 of an inch to where the bevel, the entire bevel there, is in the skin. And then once the bevel is there, I should be able to kind of see it under the skin. And then I'm not going to aspirate. And then I'm going to go ahead and inject the solution, which should produce kind of a pale wheal about 6 to 10 millimeters or 1/4 inch in diameter. Okay, so I've got the skin taut, and then I'm going to inject it about a 5 to 15 degree. The bevel is there, so I'm holding it with my dominant hand. I'm going to move my non-dominant hand and inject. And you start to see that little wheal form. And then pull it out. And then once you pull the needle out, you want to go ahead and do your safety and lay your needle down so we can dispose of it in the sharps. I'm going to take my 2x2 or my cotton swab, and I'm just going to remove any blood that may have formed over that site. I'm just going to blot it. I do not want to rub it, and I do not want to apply any kind of adhesive dressing Band-Aid over that. And then the last thing I'm going to do for this particular injection, because it is a PPD, I am going to do a 1-inch circle around where I injected that at. And that just lets me know where the injection was when the patient comes back, because they do have to come back, as you guys know, for their PPD skin test or their TB skin test to get it read. And so we can see exactly where we did it at. Okay. All right, Mr. Smith, how did you do? Any problems? No questions? Okay, so guys, we're going to go and we're just going to document the location of the injection, how the patient tolerated it, and then in our MAR, we should have documented the medication, the time we gave it, the route we gave it, the location we gave it at, and any kind of adverse reactions that might have happened. All right, Mr. Smith, let's get you comfortable and lowered down.